Hi, today I'm so happy to be here talking with you about food insecurity and associations with HIV vulnerabilities among Northern and Indigenous adolescents in the Northwest Territories, Canada. We are applying a social contextual approach to HIV prevention. I want to acknowledge my co-authors and team, including Dr. Candice Liss, who is the co-principal investigator, and she is also the co-founder and executive director of our collaborating partner, FOXY, Fostering Open Expression Among Youth in the Northwest Territories. I also want to acknowledge Nina Sokolovic, Kaylee Anexuk McKay, Amanda Kambari, Sherry Puyak, Dion Gessink, and Charlotte Lopi. So you may or may not be aware, but the Northwest Territories has food insecurity prevalence of 16%. That is nearly double the national prevalence of 8.8%. So food insecurity is a significant social determinant of health. And we also know from research across global context, largely conducted with adults and largely conducted in low and middle income countries, that food insecurity is also a social driver of HIV. Food insecurity has many pathways to HIV vulnerabilities, including harming mental health, such as increasing depression, as well as contributing to maladaptive coping strategies such as substance use. Both poor mental health and maladaptive coping are linked with lower uptake of HIV prevention strategies such as condom use. We also know that food insecurity impacts sexual relationships, is linked with transactional sex, lower sexual relationship power, and in turn, lower use of preventive strategies such as condom use. Safer sex efficacy is a concept that is actually a proxy for sexual agency. It includes knowledge, intentions, and relationship dynamics for negotiating safer sex. It can therefore be used with adolescents and anybody really, whether or not they are sexually active, because it's about knowledge and intentions and dynamics in a relationship. We've actually found in our prior research with adolescents in the Northwest Territories, for those that were sexually active, safer sex efficacy was associated with condom use. We are applying a social contextual approach as a theoretical framework to look at the interconnectedness between material context of life, such as food insecurity, and relational dynamics, and how those work together to promote or to inhibit a health enabling environment. The focus of the analysis that I'm presenting today is around exploring the direct effect of food insecurity on safer sex efficacy and the indirect effect via resilience among adolescents in the Northwest Territories. In collaboration with FOXY, we conducted a community-based research study. This involved cross-sectional surveys with adolescents aged 13 to 18 in 17 Northwest Territories communities as part of a larger program of research that was implementing safer sex education and sexual health promotion in secondary schools. In the surveys, we assessed sociodemographic variables such as gender, age, sexual orientation, indigenous identity, rural and urban residents, food insecurity, the frequency of going to bed hungry due to having insufficient food, and a multidimensional construct of resilience that looked at personal skills, social skills, peer support, and spirituality. We also used two scales to assess safer sex efficacy. The first was Kalichman's safer sex negotiation skills with items such as, I am certain that I know how to use condoms. We also looked at and used Redding and Rossi's situational self-efficacy for safer sex scale. That looks at confidence in the ability to have safer sex in different situations, such as, quote, when I'm really sexually excited, so in context of sexual arousal, as well as context of substance use and positive and negative affect. We conducted descriptive statistics and bivariate analyses, and then we tested our hypothesized pathways from food insecurity to safer sex efficacy using structural equation modeling with maximum likelihood estimation methods. And we assessed in mediation if resilience mediated the associations between food insecurity and safer sex efficacy. What did we find? We had 410 participants. Most, 79%, identified as Indigenous. Most, 85%, identified as heterosexual, and 82% lived in rural regions outside of Yellowknife. The mean age was 14.3. 45% reported any food insecurity, and this included 3% who always went to bed hungry, 4% who often went to bed hungry, and 16% who sometimes went to bed hungry. So 23% reported pretty frequent food insecurity. Food insecurity was higher among Indigenous youth versus non-Indigenous youth, 48% versus 34%, and higher among girls versus boys, 57% versus 33%. In confirmatory factor analyses, we found that the safer sex efficacy measures held together as a single latent construct, as did the 4 dimensions of resilience. Resilience as a mediator of the path between food insecurity and safer sex efficacy, that model also demonstrated adequate fit, and we adjusted for gender, sexual orientation, and Indigenous identity. We found that food insecurity was associated with lower resilience, and resilience was associated with safer sex efficacy. While the direct path from food insecurity to safer sex efficacy was not significant, the indirect effect via resilience was significant. In sum, results demonstrate a mediated relationship between food insecurity and safer sex efficacy via resilience. This is our conceptual model. Here you can see that food insecurity is associated with lower resilience, and resilience in turn is associated with safer sex self-efficacy. What does all of this mean? First, food insecurity reduces resilience, and reduced resilience is associated with lower safer sex efficacy. Therefore, HIV prevention strategies that primarily focus on building individual resiliencies are insufficient to address larger social contexts of food insecurity for Northern and Indigenous youth. Urgent attention is needed to address these high rates of food insecurity among Northern and Indigenous adolescents. And we particularly need to pay attention to the youth who are most impacted by food insecurity in the Northwest Territories, Indigenous youth and young women. We need to work on community-based strategies that look at culturally and contextually appropriate, relevant, and sustainable solutions to food insecurity. And we also need further research to disentangle other pathways from food insecurity to HIV vulnerabilities. Thank you for your time today.